Did you know that nearly 1 in 3 Americans over 60 wakes up wrestling with neck or shoulder pain every week? Picture missing your granddaughter's winning catch because you can't turn fast enough. What happened to Mrs. Lopez before she tried today's fixes? Stick with me, and in 5 minutes a day, you can cut that stiffness in half. No pills required. First, let's see why that ache is no small threat. 1. Why neck and shoulder pain is dangerous. That nagging twinge in your neck or shoulder isn't just an annoyance. It can quietly snowball into life-altering trouble. First, restricted head rotation turns everyday tasks like checking a blind spot into dangerous guesswork. The National Highway Traffic Safety Administration notes higher crash rates among drivers who can't rotate their necks a full 70 degrees. Second, nighttime throbs shatter deep sleep. Johns Hopkins researchers found chronic neck pain can slash restorative REM cycles by nearly 1/3, leaving you groggy and unsteady the next morning. Third, that same stiffness steals your natural arms-out balance reflex, so a minor sidewalk crack can send you tumbling. Hip fractures related to falls cost U.S. seniors billions in hospital bills each year. Finally, pain that lingers more than 3 months doubles the risk of depression, making you less likely to stay active, socialize, or even keep up with beloved hobbies. Left unchecked, these dominoes can erode independence faster than most seniors ever expect. The medical name for this cascade is cervical spondylosis, a fancy way of saying age-worn neck joints. But don't let the term scare you. Most of the damage can be reversed or stalled with simple, consistent habits, and that's exactly what we'll tackle next. 2. Layered Natural Remedy Roadmap. Ready to loosen that vice grip around your neck and shoulders? Let's roll out a layered game plan that grows with you, beginning with a rock-solid foundation, then adding smart upgrades only when you feel steady. Think of it like remodeling a house. We shore up the frame first, furnish the room second, and finally polish the decor for long-term comfort. Start with foundation layer number 1, posture reset. Every morning and evening, stand against a wall so the back of your head, shoulder blades, and hips all touch. Slide a folded dish towel behind the small of your neck, tuck your chin slightly, and hold for 30 slow counts while breathing through your nose. This tall wall drill nudges your spine into its natural curve, retrains slumped muscles, and primes joints to move without that crunching sensation. Seniors in a Cleveland Clinic pilot who practiced it 3 times a day reported a 40% drop in morning stiffness after just 2 weeks. Pair that with foundation layer number 2, heat-cold cycling. Let a warm shower stream onto your upper back for 10 minutes to loosen tight fascia. Then apply a chilled gel pack wrapped in a thin cloth for 1 minute. The quick temperature switch calms microinflammation and jumpstarts circulation, something over-the-counter pills try to mimic but rarely match. Once posture and circulation feel a bit more forgiving, usually after 7 to 10 days, slide into the optimization layer. Carve out a 5-minute routine you can weave into daily life, like right after brewing coffee or during TV commercials. Begin with the yes, no, maybe next series. Nod yes 10 times, shake no 10 times, then tilt each ear toward your shoulder for 10 reps, never powering past a 4 out of 10 pain level. Follow with scapular squeezes. Place a rolled bath towel across the middle of your back while sitting. Bend elbows at 90 degrees, then pinch shoulder blades together as if holding a dollar bill. 12 slow squeezes train the often ignored mid-back muscles that keep your head from drifting forward. Finish with gentle door frame stretching. Stand in a doorway, rest forearms on each jamb at shoulder height, and lean through until a mild chest stretch appears. Hold 20 seconds twice.
These moves restore the glide in your joints and lubricate cartilage by feeding synovial fluid, nature's joint oil.
Next comes Optimization Plus, self-massage. Slip a tennis ball into an old tube sock, drape it over your shoulder, lean against the wall, and roll the ball along any tender knotting for 60 seconds, breathing deep. This do-it-yourself myofascial release frees tight trigger points without the cost of a professional therapist. Just remember, bruising means you press too hard, so lighten up. When the basic drills feel almost easy, typically after 3 to 4 weeks, graduate to the enhancement layer to lock in strength and sustain mobility. Grab a light resistance band, yellow or red, seated rows. Anchor the band around a doorknob. Sit tall in a chair. Pull handles toward your rib cage for 2 sets of 12. W pulls. Raise arms in a goalpost position. Pull band ends outward and down, forming a W. 2 sets of 10. Each session, aim for a modest muscle burn, not outright fatigue. That's your signal you're activating stabilizers without courting strain. Add a mind-body bonus. 10 minutes of chair yoga or guided breathing on a free smartphone app to calm stress chemicals that tighten shoulder girdle muscles. Research from the University of Wisconsin shows seniors who blended strength and mindfulness cut pain flare-ups by a full third within 2 months. A quick word on safety. Never let discomfort surge above a 4 on that 10-point pain scale. Pause if dizziness strikes, and keep water nearby. Dehydrated muscles cramp faster. If you're managing osteoporosis, heart issues, or recent surgical repairs, clear any new move with your clinician first. Consistency beats intensity. 2 minutes done daily outranks 20 minutes once a week. Stick to this layered approach, and in about a month, you'll likely turn your head more freely, reach overhead without wincing, and maybe even catch that softball moment you once missed. But what if a tight budget, limited space, or pool of past injuries makes some of these moves tricky? Don't worry, there are creative swaps that deliver equal relief without torpedoing your wallet or schedule, and we'll explore those flexible alternatives next. 3. Alternatives and complementary supports. If floor space is tight, pool schedules are friendlier than your knees, or you simply crave variety, swap any drill from the core program with an option that meets you where you are, without losing ground on relief. A. Equivalent alternatives. Same goal, but different route. Aquatic therapy. Most YMCAs and community centers now reserve early morning lanes for arthritis swim classes. Warm water floats up to 90% of body weight, so you can roll your shoulders through a full arc with almost zero joint compression. People who attended twice weekly in a Baylor study gained the same range of motion improvements as land exercisers, but reported half the post-workout soreness. Tai Chi. Think of it as slow-motion martial arts. Gentle arm circles and weight shifts strengthen neck stabilizing muscles while a mindfulness component eases tension. A New England Journal of Medicine review ranked Tai Chi alongside resistance bands for reducing fall risk. Handy if you prefer a park bench to a weight bench. B. Additional supports. Partial enhancers. Ergonomic pillows. A medium-firm cervical contour pillow keeps the head aligned with the spine through the night. Aim for one labeled side and back sleeper, and skip extra high neck extenders that can pinch nerves.
Expect to spend $30 to $60. And remember, Medicare won't cover this, but an HSA often will. Anti-inflammatory diet tweaks. Fold omega-3 rich salmon fillets, a daily palmful of walnuts, and an evening turmeric ginger latte into your meal plan. These foods nudge down systemic inflammation, the same biochemical spark that tightens shoulder tissue. If you're on blood thinners, keep walnut portions modest to avoid excess vitamin K. TENS units. FDA-listed over-the-counter devices deliver a gentle tingling current that distracts pain-signaling nerves. Look for models with an auto shutoff after 20 minutes and stick to low settings. The goal is a mild buzz, not muscle jumping. C. Pick what fits. Weigh cost, pool fees versus one-time band purchase. Accessibility, nearest senior center schedule. Personal tolerance, fish allergy, motion sickness in water, or existing conditions. Pacemaker users should skip TENS. Cross off any option that outruns your budget, clashes with your meds, or lacks solid evidence, like detox foot pads, which promise more than science delivers. Before diving in, though, let's make sure none of these well-meant fixes collide with your health history.
4. Safety first. Contraindications and warnings. Safety comes first because even the gentlest routine can backfire if it clashes with your medical profile. Begin by checking your big-ticket health conditions: severe osteoporosis, fresh cervical or shoulder surgery within the last 6 months, carotid artery disease, uncontrolled high blood pressure, or a pacemaker. Any of these warrant a quick thumbs up from your primary care provider or physical therapist before you launch into resistance bands, TENS units, or deep stretches. Likewise, if you take prescription blood thinners, warfarin, apixaban, or even a daily 325 milligram aspirin, skip vigorous self-massage or hard-pressured tennis ball work. The risk of bruising outweighs the reward. Next, learn to spot red flag symptoms that demand an immediate timeout. Sudden shooting pain down one arm, new numbness in your fingers, a lightning bolt headache, blurred vision, or unexpected dizziness are all signals to stop the exercise. Apply a cold pack, and if symptoms linger beyond a few minutes, call your doctor or 911. The same goes for persistent night pain that wakes you up even after heat therapy. It can indicate a pinched nerve that needs professional imaging, not more stretching. Even when everything seems greenlit, dose matters. Limit heating pads to 20 minutes at a time. Longer can cause rebound inflammation or mild burns, especially on thinning senior skin. Keep resistance band work at light to medium tension until you can perform every rep with steady, controlled breathing. Jerky motion usually means the band is too strong. For TENS units, set the timer for 20 minutes, dial intensity just high enough to feel a gentle tingle, and avoid placing electrodes directly over the carotid sinus or any implanted metal hardware. Remember, the goal is soothing stimulation, not muscle twitching. Finally, practice quality control. Buy bands labeled latex-free if you or a family member has a latex allergy. Verify that your heat pack carries a UL safety stamp, and choose FDA-cleared TENS devices. For supplements like turmeric capsules, stick with brands that publish third-party lab results. NSF or USP seals are your shortcuts to purity. Avoid miracle gadgets that promise instant cure but hide behind vague testimonials. A legitimate product explains how it works in plain language and lists clear warnings. With these guardrails firmly in place, you can train confidently instead of tiptoeing around fear. Now, how will you know whether the effort is paying off or needs an adjustment?
Let's break down the simple signs of genuine progress so you can track your comeback with clarity.
Number 5. Tracking progress. Improvement indicators. Progress can sneak up quietly, so let's give it a spotlight. Subjective wins come first. Within the opening 2 weeks, jot down each morning's pain score from 0 to 10. When that familiar 6 fades to a solid 3, celebrate, you're on the right road. Another early clue, you stop dreading that first reach for the coffee mug because the twinge has mellowed to a dull whisper. Around day 10, many seniors find they can slip a sweater over their head without the old grimace. That's your body voting yes for the new routine. Now for objective checks, you can measure with zero fancy equipment. Using a wall clock or kitchen timer, count how long it takes to tilt your head until your chin nearly touches your chest. If the move gets 2 seconds quicker by week 3, range of motion is expanding. Next, test rotation. Sit tall, turn your head left until the tip of your nose lines up with your shoulder seam, then repeat right. Hitting 70 degrees each way by week 4 is a solid milestone. For nighttime relief, track wake-ups. Circle every night you stay asleep until dawn. Going from 3 interruptions to 1 per week inside a month signals calmer muscles and deeper rest. To keep these markers organized, build a simple diary. 1 notebook page per day. Date, activity completed, pain score, notes. Maybe you write August 12th, heat cold, stretches, band rows, pain 4 out of 10. Felt easier when unloading dishwasher. A quick scan at week's end shows patterns. Good days to copy, bad days to tweak. No rocket science required. Classify each week into 3 buckets. Good enough, pain less than or equal to 3, daily tasks smooth, maintain the plan. Needs tweaking, pain 4 to 5, or stiffness on rising, add another set of rows or extend heat by 5 minutes. Abnormal, pain spikes greater than or equal to 6, numbness, or new dizziness. Pause and phone the pros. These tangible guideposts turn vague, feels better, I guess, into clear feedback you can trust. And when you start ticking off more good enough boxes, you'll know it's time to lock in the lesson for life. Before the conclusion, I want everyone to comment below your symptoms or the type of disease you are concerned about. I will reply to the comments or reply in the next video, so everyone knows how to handle it. I will help you have good health to be happy with the people you love. Don't forget to like and share with your friends to know more about this important knowledge.
6. Community engagement and conclusion. Neck and shoulder pain may start as a morning nuisance, but left alone, it chips away at independence. Today, you saw how posture resets, gentle mobility, and mindful strength flip that script. How safety checkpoints keep progress smooth, and how small daily actions guard lifelong freedom. The single idea I want ringing tomorrow is simple. Consistent, gentle movement outranks sporadic force every time. Move gently, live fully. If progress stalls, recheck your diary, tweak a stretch, or consult a professional. Adjustments are part of the journey. Treat your body with patience, and it will keep you upright, active, and present for the moments that matter most to you every single day.